this is Princess from Functional Patterns. Today I'm going to explain a simple science concerning knee and lower back issue, then take you through a myofascial release of the quadriceps, more specifically on the rectus femoris. Three of our quad muscles originate from the femur, while the rectus femoris, the only one that originates from the iliac spine, which makes it a hip flexor muscle, but significantly influential in terms of lumbopelvic hip dysfunction. Let me explain. This is when the pelvis tilts and shifts anteriorly as part of a compensation process, also due to poor core functioning, causing a hyperlordotic curve and pressure on that lumbar spine. If our body has adapted to standing or moving like this, just imagine how this dysfunction will react in a dynamic environment. The quadriceps are also very influential to the knee, as these insert into the patella and tibial tuberosity. As I mentioned before, we already established the fact that the hip flexors become overactive due to sitting. This also carries the anterior muscles to become dominant, rendering the posterior chain to lose its proper function. In addition to this, the knee sits in the middle of the two longest bones of our body. If we have flexibility or alignment issues on the hips and ankles, forces from these joints during movement may dispense an odd shift in torque at the knees. When we do any type of movement such as running, jumping, lifting, squatting, or lunging, and I'm just going to imitate a very common squat here, where we put most of our weight up front, this imbalance could be an issue since the share of load is uneven between the anterior and posterior chain. Learning how to activate the posterior chain by exercising proper movement mechanics may help in correcting this imbalance. But first, we need to unload the stress of the anterior muscles by myofascial release. To release the rectus femoris and the rest of the quad muscle, we're going to utilize a PVC pipe. You can purchase this at a hardware or DIY store. We're going to lay at a prone position, kind of like a plank. And we're going to start just below the hip and roll the pipe all the way down right above the knee. This is going to be at a slower pace, guys. I'm just going to show you how to do it. Make sure to relax the other leg. And take slow, deep breaths to relax the muscle. Our goal here is to get to the deeper tissue on the full spectrum of the muscle. And sometimes when we roll the pipe, we may feel some spots that are more painful, and we're going to try to concentrate on those, okay? And over here on the frontal side, we're hitting the rectus femoris and the inner medius at the same time. Okay, and I'm just going to show you guys how to do it on the other leg for the lateralis part. Okay, and the medialis. Again, take slow, deep breaths, guys. This is going to be at a slower pace, about 15 to 30 minutes to get to the full spectrum of the frontal part of your thigh here. And I recommend to do this release at least every day or before and after your workout. I hope this tutorial was helpful to you. If it is, please like or subscribe to our channel for more videos on pain management and realignment techniques. This is Princess from Functional Patterns, reminding you to train intentionally, not habitually.